Welcome back to the deep dive. We're diving into something that's probably impacted you or someone you know, stigmatism.
Yeah.
And we're going to take a closer look at astigmatic keratotomy, or AK, a potential solution for this really common vision problem. Before we get too far, a quick reminder that this deep dive is all about giving you a solid understanding of AK, but of course, it's not a replacement for a chat with your eye doctor. Always talk to a professional for any medical advice. Okay. So imagine this. You're playing basketball, but instead of a nice round ball, you got something shaped more like a football.
Yeah.
A little tough to dribble.
Right.
Well, it's kind of what's happening with astigmatism.
Exactly. That football analogy is perfect. It really illustrates what happens with your cornea, the clear front part of your eye. In a perfectly shaped eye. It's like that basketball. Nice and round, but with astigmatism, it's more like the football. A little bit oval. And that seemingly subtle difference is what causes blurry or distorted vision, whether you're looking at something near or far.
Okay, that makes total sense. So how does AK come into the picture? Is it like reshaping that football into a basketball?
You got it. AK is a procedure designed to reshape your cornea. And yes, you can think of it like gently sculpting that football shape back to a smoother, more rounded surface. It involves using a laser. So high-tech. To make incredibly precise incisions in the cornea. The goal. Guiding light rays properly so you can see clearly.
Wow, lasers. Now I'm picturing something straight out of a sci-fi movie. But seriously, what would someone actually experience if they were considering AK?
Our sources dive into the step-by-step, and I'm curious to break it down. Absolutely. It all starts with a detailed mapping of your cornea. It's like creating a super precise topographic map, but for your eye. This map shows us the exact contours of your cornea, highlighting the steeper areas that need attention. It helps us tailor the procedure specifically to your eye's unique shape.
So it's not a one-size-fits-all approach.
Right.
Which makes sense. Each eye is different, just like our fingerprints. Okay, so you've got your map. Then what happens on the day of the procedure itself? Walk us through it.
Well, first things first. We make sure you're completely comfortable. We use anesthetic drops to numb your eye. You won't feel a thing. Then, to keep your eye perfectly still during the procedure, we use special techniques. This ensures the laser can work with absolute precision. Think of it like taking a super steady photograph. We'll also place temporary markings on your eye, which act as guides for the laser, showing it exactly where to go.
Okay, so the laser part. That's where things get really interesting. What exactly is the laser doing to reshape the cornea?
Here's the fascinating part. The laser makes tiny incisions in your cornea, typically just 1 or 2 per eye. These incisions are incredibly precise, placed parallel to the cornea's edge, and targeting those steeper areas we identified earlier. And here's the really cool part. The depth and length of these incisions are directly related to how much astigmatism we're correcting. More reshaping needed. Slightly deeper, slightly longer incisions. It's truly personalized. And the best part, the whole laser procedure is super quick, usually just 5 to 10 minutes per eye.
5 to 10 minutes and you're done.
Yeah.
That's amazing. Okay, so the laser's done its thing. What about recovery? What can someone expect after those few minutes of high-tech eye sculpting?
You're back on your feet surprisingly quickly. You head home shortly after the procedure. And you'll have some antibiotic eye drops to prevent infection. You might also get some steroid drops, which help manage any inflammation. Think of it like a soothing spa treatment for your eyes after their little workout.
I love that analogy.
Yeah.
But realistically, are we talking cucumber slices and relaxing music?
Right.
Or are the first few days after AK a bit rougher? Our sources do mention some potential side effects.
You're right. Let's keep it real. It's important to be prepared for some mild discomfort. You might experience some tearing, a bit of swelling, and sensitivity to light. Completely normal, and these typically fade within a day or 2. Your doctor might suggest wearing eye shields for a bit, especially while sleeping, just as a precaution. And over-the-counter pain relievers can help if needed.
So a little bit of TLC for your eyes, but nothing too extreme.
Yeah.
When do people typically start seeing a difference in their vision?
Here's the exciting part. Most people notice a vision improvement within the first day or so. Of course, full healing takes a bit longer, usually around 2 to 3 months. But many people can get back to their routines, even head back to work the very next day.
That's incredible. So for someone who's been reliant on glasses or contacts their whole life, what's it like to suddenly experience that freedom? Our sources suggest it can be quite transformative.
It truly can be. Imagine waking up and seeing the alarm clock clearly without fumbling for your glasses, or being able to jump in the pool without worrying about contact lenses. These are the kinds of everyday experiences that AK can make possible.
Okay, so we've covered the what and the how of AK. Let's shift gears a bit and talk about the who. Who makes a good candidate for this procedure? Is it for everyone?
That's a crucial question. While AK is a fantastic option for many, it's not a one-size-fits-all solution, ideally. Candidates have mild to moderate astigmatism and a stable eyeglass prescription. We're talking at least a year without significant changes. Overall, good health is important too, as with any procedure.
That makes sense. So it's not just about the numbers on your prescription. It's about your overall health and lifestyle, too.
Precisely. For example, someone with a very active lifestyle, say a competitive swimmer, might have different needs and considerations compared to someone who primarily works at a computer. And certain conditions, like severe dry eyes or autoimmune diseases, might require a different approach altogether.
It really is. It's about finding the right fit for each person.
Absolutely. And that's where that open communication with your eye doctor is so important. They'll consider your individual needs, your expectations, and any potential risks to determine if AK is the right choice for you.
Speaking of risks, let's address the elephant in the room: safety. Any surgical procedure comes with inherent risks, and our sources are very upfront about potential AK complications.
Transparency is key for sure. While AK has a very good safety profile, complications, though rare, can occur. For instance, there's a possibility of overcorrection or undercorrection, meaning your vision might not be perfect right away, and further correction might be needed.
So it's not always a one-and-done kind of thing.
Exactly. Most people are thrilled with their results, but it's essential to have realistic expectations. Some people might experience prolonged light sensitivity, glare, or halos around lights, particularly at night.
Those sound like things you definitely want to discuss with your doctor beforehand.
Absolutely. It's crucial to weigh the potential benefits against the risks. In extremely rare cases, there's a risk of weakening the corneal structure or developing an infection. That's why. Circling back to our very first point, open communication with your eye doctor is paramount.
It's all about that shared decision-making, right? You, armed with the knowledge we're diving into today, and your eye care professional with their expertise working together.
Couldn't have said it better myself. This deep dive is all about empowering you with information, but that final decision always rests with you and your doctor.
Absolutely.
Yeah.
So, to wrap things up, we've learned that AK can be a real game changer for people with astigmatism, reshaping their vision, so to speak. But like any medical procedure, it requires careful consideration, a thorough evaluation, and open communication with your eye care professional.
Well said. And it makes you wonder, with all the incredible advancements happening in vision correction, what does the future hold for procedures like AK? Will it become even more precise, even more tailored to the individual? What new innovations are on the horizon? It's fascinating to think about.
Definitely something to keep our eyes on. Thanks for joining us on this deep dive into the world of astigmatism and AK. We're here to fuel your curiosity, one fascinating topic at a time. Until next time, stay curious.